The video you're about to watch depicts real events. The people you'll see are actors, but they're portraying students as they go through their interprofessional simulation exercise in our CAPE Center. This is an exercise that you will go through as well as you progress through your interprofessional education experience. We ask that you think about the fact that these are your fellow students as you watch this. Be professional in how you view it, be professional in how you speak about it, and think about the fact that these are your colleagues and your goal is to help them improve their performance.
Hi everybody.
Hi. Hi.
So we just finished our break, and just a quick reminder of what we talked about before we took our break. We set some communication goals and some communication tools. Communication goals were share information actively and find ways to contribute more effectively. And the tools that you chose were SBAR, call out, check back, huddles, and the 2 challenge rule. Does that all sound like what we discussed earlier?
Yeah, sounds
okay.
great.
All right. So Corey, would you mind introducing us to our next patient?
Sure. Looks like the name is Jordan Evans. The setting is in the emergency room. It's 55-year-old Jordan Evans tripped over his dog yesterday and landed on his shoulder. He did not think it needed to be checked right away. This morning, the pain in his shoulder has gotten worse and it's interfering with his physical activities. His wife decided to bring him in today because he's still in a lot of pain and has limited range of motion. The age is 55 years old. His weight is 180. His height is 5'9". His initial vital signs show that the heart rate's 95, saturation's 95% on room air, blood pressure is 135 over 80, and respiratory rate is 20.
Okay, great. Thank you, Corey, for reading
So
that
if
for
he
us.
fell, he could have a possible break, a fracture, a rotator cuff tear. So I'm thinking right away we're going to need to get an X-ray.
Mm-hmm. I mean, so did they already do an X-ray?
Oh, good point.
Are they so they're in the emergency room? Is that what they said?
Yeah.
Okay.
So I mean, obviously, if he's in the ED, he's in quite a bit of distress. So, but yeah, let's definitely check and see if anything's been taken.
And his vitals kind of sounded a little high.
They did sound a little
maybe.
off.
I don't know.
So yeah, I mean, he seems like he might be just a little bit hypertensive. I mean, that could be anxiety from being, in the emergency department. It could be, white coat
So we want to
hypertension.
double
but
check.
let's
So it sounds
definitely
like you
check
guys are
that.
already talking about the plan of care. So why don't everybody flip to page 17 in your guidebook? And would somebody be willing to take us down the brief?
Yeah, I will. Okay, so plan of care, we were talking about that, getting the X-ray, depending on what that shows, maybe getting an MRI to see if it's soft tissue damage. Definitely addressing vitals, so we want to do that. Like
I can do that
right
when I
away.
come in.
Okay,
Yeah.
that'd be great.
Mhm.
And then, kind of, if anything is, off, we definitely need to take care of that right away. Communication goals.
Does anybody have any other thoughts on plan of care?
That sounds good.
Okay.
So communication goals, we talked about
Sharing information actively and finding ways to contribute more effectively. Is that still what you want to continue with?
Yeah,
Yeah, I
that
think
sounds
so.
really good.
All right.
And then communication tools, we talked about doing the huddle, SBAR, call-outs, checkbacks.
Yeah.
And the 2 challenge rule.
And the 2 challenge
Yeah.
rule.
Sounds pretty good.
Yeah, I think we
I
should
mean, I don't
stick
think
with those.
we didn't do a whole lot last time, so it'd be good to.
Right, and
Stay
you
with
want to
them.
do the huddle earlier
Yeah.
and more frequent call-out checkback?
Sure.
Okay.
Sounds good.
Leadership,
How do we want to lead the team? Would anybody like to
I'll lead
volunteer?
it. Yeah, I'd be happy to lead it.
Okay. So
Yeah.
Cindy's
I mean, are
gonna
you
be
sure?
team
Do you
leader.
want to?
Yeah, that's fine.
I'm cool with that.
Okay. And then roles and responsibilities.
I mean, I said I'll check the vitals
Yeah.
for sure when we go in, and I can
definitely
see
think-
if there's an X-ray.
Yeah, maybe you could do that, be on phone, sort of that sort of thing.
Yeah.
We'll need someone to scribe. We'll need maybe someone to do a history.
Francis, Corey, do you have any ideas of what you'd like to do?
I could scribe.
Yeah, I'll do history, whatever you guys want me to do.
Okay.
It's fine.
And maybe have someone on in case there's a family member in the room.
Sure.
Okay.
Yeah. No problem.
Cool. And then reviewing team resources, utilizing the phone for sure. Definitely, because we're going to call for the X-ray, so we'll use radiology. I don't know, maybe some labs, depending on what
Yeah.
those vitals look like.
That's probably a really good idea. We
So
can take
maybe
labs. I can do that.
laboratory. Okay.
Great, and remember that resource of the phone.
Yeah.
What's your biggest resource?
each other.
Yeah. Okay, great.
Cool.
Everybody feel ready to go?
Yeah.
Definitely.
Okay, let's go.
Let's do it.
Hi, Mr. Evans.
Hello.
Hi, my name is Sydney. I'm a medical student. They'll be taking care of you today.
Okay.
Can you tell me what brings you in here today?
Yeah, my shoulder's been hurting me for
Your
a while.
shoulder?
It's that one.
Oh,
that
it's this one
hurts.
here? Your
That
left
hurts.
shoulder?
Yeah.
Okay. So how did this start?
I tripped over my dog
Oh.
a few days ago and fell on my shoulder. It's
Oh,
been
so you actually
bothering me.
fell. Okay.
Yeah. Who are these folks?
Well, this is your medical team here. Would you like to go ahead and introduce yourselves?
Hi, I'm I'm Frances, and I'm a pharmacist, and we're gonna be helping to
Okay.
take care of you.
I'm also a pharmacist. My name's Corey.
Okay.
I'm Pat. I'm your nurse.
So
Okay.
we're here to take care of you, Mr.
What are you
Evans.
doing with my shirt?
I'm just gonna connect some leads to you.
My wife was in the hallway. Can she come in, please?
Oh, sure. What is your wife's name?
Jamie.
Jamie. Would you
Yeah,
mind
yeah,
seeing if
yeah, of
Jamie's
course.
out there? Okay. So I'm gonna go ahead and listen to your heart.
Oh, yeah.
Breathe.
Jordan, how are
Your
you
husband
doing,
asked
baby?
for you.
Okay.
I just still dizzy a little bit. And
Oh, you didn't tie your shoe.
nauseated.
You're nauseated still?
Yeah.
Do you,
Oh my gosh.
do you mind if I ask you a couple of questions? Are you allergic to any medicines?
Yeah, I'm allergic to
Did you say he was feeling
penicillin,
nauseous?
sulfa drugs, and iodine.
Okay.
Right about after breakfast.
And
Sir, you say you're feeling nauseated?
Yeah, all day.
All day. Okay. Do you feel like you're having any discomfort at all in your chest?
A little bit, just a
Little
little,
bit?
like it's hard to catch my breath a little bit.
You're having some trouble breathing? I know
So-
his heart rate is going up.
Yeah.
Do you want me to give any kind of drug?
Well, no, let's go ahead and let's get him started on some oxygen because he said he's having some trouble breathing.
Like a nasal cannula or?
Yeah, let's do a nasal cannula and then
Should find out what meds he's
you know
on.
what? Let's go ahead and get some Ativan.
can you
Okay, how much?
tell us what
Ativan.
medications you're on right now?
Yeah, I'm
What would the
on
dosage for
aspirin,
Ativan be?
baby aspirin,
For
and
Ativan?
Zolpidem, Zocor, and nicotine patch for
Baby
Standard
aspirin,
dose. Let's just do a standard.
nicotine patches,
Zocor.
Zocor.
I'm sorry.
Diltiazem.
Okay. Are you
Diltiazem?
taking those drugs for high
you get that?
cholesterol and high blood pressure?
Yes.
Yes, you
And
are.
then the baby
Okay.
aspirin.
And did you
Yeah.
take
And
those
he's on
medications
pushing
today?
Ativan.
Okay, and the nicotine
Why?
patch.
What do you? Ow! What do you
Baby
give
aspirin.
Well, your heart rate is just a little bit up, and we think you might be just feeling a bit anxious, and we noticed that you're having a little bit of trouble breathing. So
I
we're going
feel
to give you
so
some oxygen.
dizzy right now.
How much do you
You're dizzy
know?
now,
You're
Jordan?
dizzy.
How much liters? do you have? How many
Let's
liters?
go ahead and let's just start him on about 4 right now. and then we'll go
I'm sorry,
higher.
baby.
Yeah, you're feeling dizzy now,
Yeah, my chest feels tight.
and your chest feels tight. Okay.
I shouldn't have smoked that cigarette, Jamie.
You had a
know
cigarette
what?
this morning?
Yeah, I know.
Jordan, you're not supposed to
Heart
have it.
rate
That's
is
what
still
I
going
know.
Coach
I
said not
just,
to have any
just a
while
few
you're on the
puffs,
patch.
really.
What is his blood pressure reading?
My
I just refreshed it. We're still
Was he
waiting on
wearing
that.
the patch?
my
when he
chest
was-
he's
feels
got that
really.
on
O2 is a
now.
little bit low.
Oh.
What's going on,
I
sir?
think he's turning a little
my
blue.
chest.
He is. He's
Oh.
getting cyanide.
Just wait for him,
His
please.
heart rate is going way up. You know what? Let's get him started on some amiodarone. So can we get a dosage on amiodarone? So we're going to give you a drug to kind of help bring that heart rate down.
Oh, this hurts.
How much does he weigh?
Do you know the
30
dose?
pounds.
80 pounds.
How much do you want me to do?
Let's go 150.
150. Okay.
I'm sorry,
Okay.
baby.
So we're going to go ahead and give you medication.
Pushing 150 of
And
amiodarone.
then, you know, let's also get
150, is
some
that okay?
morphine on
I don't
board
know.
here.
Okay, how much morphine?
Dose on morphine.
Kind of a lot.
Standard dose on morphine.
Morphine.
Okay.
Yeah, that's going to help with the pain. And if let's also do
I'm pushing morphine.
morphine. Let's
What's going on with my
also.
husband?
Well, his heart kind of went up
do
and
all
he's
three?
complaining of some pain.
Do you want me to change this to
Is it
mask?
like
Yeah, let's go ahead and put a mask on him and let's
dose.
crank that up a bit. 'cause
Is
it's
it like the
too slow.
angina that he's had?
I think it is. It seems to be a little worse. Last time did they give him the
But
nitro
give me that stuff under the tongue.
under the tongue? Yeah, let's go ahead and do that too. Let's go and give him the sublingual nitro.
four of
Okay.
these things together at the same time.
Oh my gosh, I have no idea.
Yeah.
I'm here, baby.
So we're going to give you
Sulfa
something
drug.
under your tongue here.
Is it?
Do we have that?
I'm here.
I can
Hold
call
my
for it.
hand.
or you guys-
Sir, I'm going to just kind of squirt this under your tongue. 2 little squirts.
Did you hear how much morphine?
All right. That should help with the discomfort. How's your chest feeling?
It hurts.
Did you give
How
him
much
morphine?
of the nitro? You're giving him more
I gave.
morphine?
We gave him morphine already.
Yeah.
Yeah.
How much was that?
We gave him standard dose.
Yeah, standard.
I didn't
Yes.
hear.
Okay.
You know what? His heart rate is still not coming down, even with the. I think we should do a cardio version on it.
dose of morphine is.
I've never heard of that for this.
Yeah,
All of this
it will
together?
just like a
no
mild
idea.
shock that will go ahead and lower his heart
We're gonna
rate.
shock him?
Well, we're gonna try to shock him back into a normal rate. Right now,
God.
it's really high.
Baby, they're gonna shock him,
um,
but they just put him
So let's go ahead and do that.
Okay, maybe we'll back up just a
Oh,
little
good.
bit.
Baby, I'm right here, okay? I'm not leaving.
Here, if you want to sit down, you can sit down.
Do you want to leave or did you
No,
want
I'm
to stay
not
along?
leaving my husband.
Okay.
So it says it's on
I don't
200
want
joules.
Okay, so I guess they're going to give him a little
I'm
shot.
to shock him.
Oh my God,
I
what
don't
is
think so. I feel a little
Okay,
bit
so
better.
it's mild. So
This
that's
is
probably
obviously
gonna
not
be
mild.
okay.
Feeling a little bit better.
He's feeling a little better, you're saying.
Okay, stand clear, please. I can't get this to reach.
I don't know if
Hat, can you see what's going
Don't.
on with that?
I don't know if this
Thank you.
is right.
All right, standing clear, please.
Are you
Going
sure
to
this is-
administer shock. Stand back.
Just be it's a little one.
Did it go?
Oh, you want to charge it?
Yeah, I
Oh.
thought it did charge it.
Oh, God.
200.
Honey, I don't know.
Audit.
I don't know what they're doing it either,
200.
baby. I almost
It
wanted to
isn't
Stand clear,
laugh.
please.
Okay.
All right, shock administered. And heart rate is going down. All right. Good. Heart rate is dropping.
That doesn't look.
He's going
right.
into asystole. Let's begin compressions.
What's going on? I thought you said
We
everything
seem
was
to have
good
lost
better.
his heart rate.
Oh, God.
So, yeah, could you get an ambu bag out? Sure. Can somebody keep time for me, please?
Yeah, I'm okay. I'm keeping time. That's 10.
Jordan?
15.
30. Give me 2 breaths.
Yeah, 1 second.
Okay.
2 breaths. 2 breaths.
Okay.
Okay.
Check for pulse.
Do you want me to check for pulse?
Yeah.
What's going on, baby?
Okay.
We're checking for
Wake up.
pulse. We've got
Is
a
that
pulse.
better?
Okay, that's
We've
good.
got a pulse. That's good.
That's good that we've
Yeah,
got
I
that.
think-
Okay.
Sir, can you hear me, Mr.
Jordan, wake
Evans?
up.
Mr. Evans?
Baby, talk to me. Open your eyes.
Mr. Evans? Okay, good.
Okay.
All right, we got him back.
Okay.
I think we're
okay.
good.
Okay.